As of 2015, 164,000 Australians are living with autism spectrum disorder, or ASD. Statistics also show that 83% of individuals with ASD are under the age of 25. With this in mind, it's vital that educators have awareness of and access to a number of evidence-based practices for providing affected students with a rich and valuable educational experience. Evidence-based practices being instructional approaches, interventions, or teaching programs which have been proven to work through trial and research. ASD is a developmental disorder, and its symptoms can be divided into three categories, which are social, behavioural, and communicative. Symptoms of ASD include impaired social interaction, the inability to make and maintain connections with other people, sensitivity to sensory input such as the sound of a car driving past or the sensation of a certain fabric on the skin, failure to interpret social cues, be they verbal or physical, restricted or unusual interests, and repetitive or obsessive behaviours. The inability to communicate is a significant challenge for people living with ASD and for those who work with them. While many people with ASD have a wide vocabulary and are well articulated, a number of sufferers have limited speech and vocabulary, and some are unable to speak at all. A few more facts about ASD. Symptoms of ASD are usually detectable in children between the ages of 18 to 24 months, and symptoms can include attachment to inanimate objects, discomfort with everyday sounds, a lack of interest in other people, and the inability to speak by 18 months of age. There are three main types of autism. They are classical autism, which is the diagnosis given when a child displays most of or all of the symptoms of ASD. Asperger's syndrome, also known as high-functioning autism, does not affect the intelligence or language skills, but manifests itself in impaired social interaction and communication, as well as repetitive behaviours. This form of ASD is often detected later than classic ASD due to the lack of symptoms. Lastly, pervasive development disorder, or atypical autism, is a diagnosis given to children who may exhibit social and communicative difficulties and/or repetitive behaviours, but do not otherwise meet the criteria for a diagnosis of classical autism. So what does ASD look like in the classroom? It's commonly observed that people affected by ASD struggle with social aspects of the learning environment. Their inability to interpret and respond to social cues often affects their abilities to engage in conversations, develop skills which help them to play with others, and to build and sustain friendships. This can often lead to affected individuals becoming withdrawn. Reading comprehension is also difficult for a number of people with ASD. It is due to a lack of social understanding, difficulties with language, and deciphering the intentions behind what people say that these individuals often misinterpret the purposes or meanings of various texts. Finally, a significant challenge for many people living with ASD is an unawareness of social rules or the hidden curriculum within the classroom environment. This tendency can manifest itself in what may appear to be a disregard for the rules, with affected students bypassing lines and being unwilling to take turns in games or when using equipment. So how can teachers help to combat some of the issues which face students with ASD in the classroom? The first strategy I'd like to talk about is direct instruction. Direct instruction entails a detailed lesson plan with clear objectives and where the needs, strengths, and weaknesses of students are considered. Positive results have been achieved when teachers directly align their lesson plans with the skills or concepts which are the objectives of the lesson period. Instructions which are thorough yet clear and concise. Instructional periods are often challenging for sufferers of ASD, and confusion and loss of focus can often occur. When the purpose of the lesson and the teacher's expectations of the student are clearly delivered in approximately sized chunks, these individuals are often found to be more receptive and to have an easier time of taking in instructions. Teachers providing thorough instructions on how to and how not to complete tasks. Consideration given to the structure of the learning environment so that sufferers of ASD can clearly hear instructions and are grouped with individuals who can assist them or will not interfere with their learning. And finally, constant interaction between the teacher and the learner throughout the lesson period. This helps ensure that students stay on task and do not become confused or overwhelmed. Next, we have self-management. Self-management is a set of skills and techniques which can be taught to sufferers of ASD to help them take control of their own learning and behaviour. Aspects of self-management are self-monitoring, where through discussions with a teacher, a parent, or educational assistant, students analyse their own behaviour, identifying negative behaviours and deciding on positive alternatives. Students then record the instances of their positive and negative behaviours, such as calling out in class or attempting to engage with a peer, and discuss their performance with their teacher. This is a great way of having students take responsibility for their own behaviour and empowering them to contribute to the classroom environment. Goal setting, where teachers assist students in identifying elements of their performance which can be improved and setting goals which they can work towards. Important elements of goal setting are helping students to understand their current performance, helping the student to set an achievable goal, devising a plan by which they can reach that goal, and regular reinforcement and encouragement provided to the student by the teacher. Last on the list is self-instruction. Self-instruction is achieved when students are given the skills to coach themselves through activities and keep themselves on track. At the beginning of each task, teachers should provide students with a set of steps which will help them complete the activity. These can be written or drawn. Students can then guide themselves through the activity by completing it step by step and reminding themselves, verbally or otherwise, what they must do next. So as you can see, self-management is a useful tool in allowing students with ASD a degree of independence and autonomy in their learning. So those are just a few of the practices which have been proven to work when working with ASD-affected individuals in the learning environment. I want to thank you for viewing this presentation, and I hope that if you do find yourself teaching students with ASD, that some of these strategies are useful to you. Thanks again.